Hello everyone, let's discuss another questions. So our first question is here. A patient who underwent the left supratentorial surgery to treat a brain tumor was taken back to recovery area. Which posture should the nurse put the patient in to encourage the venous drainage? With the head in the neutral position, that bed head lifted by the 30-degree, having the head turned to the right while flat on the ground, lying flat with 3 cushions supporting the head, and lying on the left side of the client. So here the question given, you can see here the condition given, patient undergoing the left supratentorial surgery, and for what it is done to treat the brain tumor. So now the question is asking for the position, means which kind of position we have to recommend the patient to encourage the venous drainage. So let's solve this question. Surgery, or we can call it the supratentorial craniotomy, and there are some major indication of this surgery is about the brain tumor. Okay, so brain lesions or the brain tumor, to treat these disease conditions we perform this surgery. So now here, like, question is about the position, means which kind of position should be or craniotomy to promote the venous administration. Okay, because if we will recommend the position that is the supine, so you can see here, like, it can lead to the increase in the intracranial pressure. Okay, so whenever there will be the concept of the increased pressure, that can also lead to the some brainstem herniations or other conditions. So we will recommend the client that is the head end of the bed is elevated up to the 30-degree to encourage the venous drainage and low down the, means to increase the venous drainage and decrease down the intracranial pressure. Okay, the position of the client's head should be the midline or the neutral, and to prevent the displacement of the cerebral contents by the gravity, patient undergone the supratentorial surgery should be positioned on the side is not being operated. Okay, so here this is the exact reason that why we always position the client for this. So now here the right answer. So as the question I have explained you that the patient is underwent the supratentorial surgery, that means to expose the cerebral hemisphere. This is a part of a craniotomy, and to treat the brain tumor. Okay, and now the position means which kind of posture should the nurse put the patient to encourage the venous drainage. So I have explained you that to promote venous drainage and lower down the intracranial pressure, we always position the client with the head in the neutral position and the bed's head lifted by the 30-degree of the bed, and the remaining other options like having the head turned the right while flat on the ground. So this is not the right option here, because flat option you can see here, like the supine, this can lead to the increase intracranial pressure. So this is an inappropriate option. Lying flat with the 3 cushions supporting the head, this is also again lying flat is not in the right option here, because it also lead to the increase intracranial pressure, and lying on the left side of the client. So this is also the inappropriate option, because we always position the client that is not assistant of the nursing assistant to act as an interpreter, employ the non-verbal communication in addition to the little understanding of the client's language that you learned in the high school, and hire a qualified healthcare interpreter. So now here question given sorry. So you can see here what kind of condition given, means the basic concept that is a non-English speaking client and having the condition breast cancer, but she travels with her daughter who is fluent in the English. Now like, how can the nurse get the right client's admission information? So what kind of the measure she will use? So you can see the options here. Now let's solve this question. So firstly we will know about the what is the medical interpreter. So we know the medical interpreter is aware of the patient cultural tradition and the rights. The confidentiality of the client is violated when a family member acts as the interpreter. So we know the meaning of the medical interpreter, who is aware about the patient cultural traditions, or means we can say that all the right information regarding the client having the medical interpreter. So means the right knowledge and the client's informations regarding the confidential information, cultural traditions. So this is the definition of the medical interpreter. And you can see here with the diagram, a certified medical interpreter is responsible for making the complex healthcare information easily understand for the average patient. So now how is the right option will be there? So we can see, so in order to protect the, means we have to protect the confidentiality. Confidentiality means concept of privacy. Sorry, privacy, historical data, accuracy, safety, everything. So we have to kept in the mind regarding the confidentiality or the privacy of the client. So in order to protect the client's confidentiality, historical data, accuracy, safety, a qualified medical, and the medical interpreter is always aware that I have explained you that patient's cultures and rights. The confidentiality of the client is violated when the family member act as interpreter, but it is not possible to guarantee the correctness of the interpretations and back translations. So we can say that we can use like on a family member who can having the right information regarding the client, so that he or she can act the medical interpreter of the client. So now see the right option here. So as I've explained you, option number 1 will be the right option here. Request the daughter of the client to act as an interpreter. Right, remaining sorry, remaining another options are not correct here. Option 2, 3 and 4, because these are an inappropriate, like hire a qualified healthcare interpreter. So it is not option right option here, because he or she will not have the like admission information of the client, or in non-verbal communication, like this is also an inappropriate option. And request the assistant of the nursing to act as an interpreter. So basic concept of here, like the protect the client confidentiality, historical data, accuracy, safety, exactly. So we know that only the family member who that he or she can fluent in the English, that the possible requirement can be completed here. So option number 1 will be right option here. Next question 3. A client who had a hold laryngectomy for a laryngeal cancer is being cared by for a nurse. What details should the covered in discharge instructions please apply all that? 1. Creating humidity in the house. 2nd, consuming a bland food. Then 3rd, acquiring a suction skills, working with a speech therapist to improve communication, and participating in a walking. So here the question cancer means the client having the laryngeal cancer, and on the treatment basically the surgical intervention made, that is the laryngectomy. So now the what is the question is asking about, like the instruction means which kind of instruction the nurse should always cover during the discharge program. So whenever the client is going to discharge, which kind of instruction should the nurse cover during the laryngectomy? So now options are given. Let's solve this question. So here the diagram of the laryngectomy, you can see here the removal of the larynx. You can see here this is the portion of the larynx. Sorry for the voice interruptions here. So larynx, here are the vocal cords, esophagus, trachea, and whenever there will be the removal of the larynx or the laryngectomy. So now for the laryngectomy, like I have explained you, laryngeal cancer or the tumor. So here's the basic procedure involve the removal of the part or the whole larynx. So whenever if you will only remove the vocal cord, then it is a partial laryngectomy, and if you will remove the whole larynx, then it can called as the complete laryngectomy. So now here, like which kind of instructions here? So basic educations for the laryngectomy here. Basic concept of here about suctioning, stomach here, and airway after the laryngectomy, like client you do have the proper stomach care, there should be always the proper humidification or the ventilation in the atmosphere of the client, and the concept of suctioning to suction out all the clarities about here. So suctioning is the basic concept to clear the airway, and humidification, the speech therapy, always the recommended or always the skillful or the teach for the patient here. So three main concepts regarding the, so like these are not the priority like the nutrition, home management, resources, but they are also the necessary teaching regarding the laryngectomy, like the internal nutritions and stomach care, prevent the constipations and support group and the information group. So these are the basic education for the patient that is undergoing the total laryngectomy. So here the three main concepts about the airway maintenance and the communication. So airway maintenance, how we can perform it by the stomach care, daily stomach care, maintaining the humidification in the atmosphere, and suctioning to drain out the excessive fluid or excessive mucus to clear the airway. And here communication, that is the speech therapy or the uses of the laryngeal communication devices to forms up the communication. So let's click the right options here. So first option, like creating a humidity in the house. So it is exactly the right option here, because this concept correlates with the airway maintenance. Then option 3, acquire suctioning skill, also the right option here, because whenever we suction out the excessive mucus, then it can lead to the help the airway clearance and also help in the airway maintenance. So this is also in a right option here. Option 4, working with a speech therapist to improve communication is here, because the speech therapy is also an important part. Speech therapy is an important part of the laryngectomy, because now client have to improve the speech skills or the communication skills, like how to use the voice mayors and how to use the larynx devices, or how to improve the communication with the help of the speech therapy. So it is also an important measure for the client having the undergone the laryngectomy. Then option number 5 here, the participating in a program to stop smoking. This is also in a right option here, because the smoking is a most precipitating or the leading cause factor of the airway disturbance. So now if the patient will not stop smoking after the laryngectomy, then airway clearance maintenance no will be there, and the disturbed airway, dyspnea like conditions, shortness of breath condition will be there. So these options are option 1, option 3, option 4 and option 5 will be right option here. Consuming a bland food, like here the consuming a bland food may be the right option, but not in a priority or the like priority covered in the instructions, because we have to protect the client from the constipation here. So this we will not consider this exactly the right option here, because our priority is basically about the airway maintenance, and second is about the speech therapy. These are the highly recommended instructions for the patient that is going to the discharge after the laryngectomy. So these options will be right options here. Now question number 4. The patient has a headache after having the electroconvulsive therapy, that is ECT, and our ego. Which of the nurse response is the best? Option 1, I'll get some Tanacol acetamin for you. A headache following ECT is common. Take a nap, you will feel better. Have breakfast and let me know how you feel later. So here the question given, the basic concept here about the ECT. ECT means the electroconvulsive therapy, we all know. So ECT basically a psychiatric procedure that given for the depression patient. ECT is the main indication of the ECT is the major depression. The client having the major depression is undergone for the ECT. So now here what is the question asking for, like which of the nurse response is the best. So we know here the some complication of ECTs like the retrograde amnesia, headache. These are the some like the basic complications of the ECT. So now we consider is the complication, that is headache, that the first complication after the ECT here. So now the for the complication headache, which of the nurses response will be best here. So you can see here how to solve this question. Let's see. We know that the post ECT headache is typically treated with the acetaminophen or the non-steroidal anti-inflammatory drugs, but occasionally require agents such as the supratentorial opioids or the beta blockers. So now this is the given here, like I have explained you that post ECT headache is the basic complication of the ECT. And now how we can treat this headache of the client. So we will administer the NSAIDs, non-steroidal anti-inflammatory drugs, and the acetaminophen is also the classification of the NSAIDs. So we know acetaminophen is the classification of the NSAIDs, and these NSAIDs we you know for administering of the analgesic or the antipyretic purposes, that is the headache. So this will be the right option here, that direct administration of the acetaminophen. And now here like how it works, if we are solving this question, so we have to knowledge about the mechanism of action, like how it works. So basically we know acetaminophen is a COX inhibitor. So we know that firstly there will be the reduction of COX pathway lead to inhibit synthesis of prostaglandin in CNS, and somehow it block the pain receptors, blocking of pain receptors. And how it works, how this works, sorry. So you can see here, this is the exact mechanism of the NSAIDs of the acetaminophen classification, that there will be the reduction of the COX pathway and it inhibit the synthesis of prostaglandin in the central nervous system, and that lead to the blocking of the pain receptors. So let's solve this question. So the patient have a headache after the ECT. So the best nurse response is the option number 1. I will get some Tylenol, that is acetamin for you. This is exactly the right option here. And remaining options like a headache following ECT is common, taking a nap you will feel better, having breakfast and let me know